Hi there. Welcome. Thank you for joining us this afternoon. My name is Amanda Law. I am the Event Marketing Manager at Cadmium, and it is my pleasure to bring you today's webinar, Mastering Accreditation and Analytics. We are going to be talking about streamlining compliance and driving insights with EthosCE. We are exploring today how EthosCE optimizes both accreditation and helps to drive insights, helping healthcare organizations not only simplify compliance, but also leverage data for better decision-making. I can think of no one better to share on this topic, excuse me, than with Cadmium's own Raja Venkata. Raja has a strong background in both software development and business and 17 years of experience in designing scalable technology solutions for healthcare education. He is the expert we want to hear from. I'm thrilled to have you here with us, Raja, to share your expertise on how organizations can simplify accreditation compliance and harness data analytics for better decision making. I'm going to kick it over to you. Thank you.
Thanks, Amanda. Appreciate the kind words. Good afternoon, good morning, good evening to everyone. Thank you so much for taking time amongst your busy schedule to talk a little bit about an interesting topic, something that I believe all of us are very passionate about, because it's hardly a drive for all of us when we're working with accreditation management. So today we're going to talk a little bit about streamlining compliance and driving insights with EthosCE. We understand that some of you may already be using Ethos, our veteran Ethos customers. So in that scenario, some of the things are things you might already be trying out. So in that scenario, we'd love to hear about how some of the things we're talking about have worked for you, or other areas that you would like to see more of these come in, just so that we can take your feedback and start improving the product further. So by all means, feel free to keep these questions coming. Any ideas, feedback is always appreciated. All right, with that understanding, let's talk a little bit about the agenda. The first thing shouldn't be super unfamiliar. We'll talk a little bit about accreditation landscape, some of the challenges that we routinely face when we are working with providers, and providers when they're working with their accreditors. So just a little bit of background there. And then we'll talk a little bit about some of the opportunities there in terms of reporting the credits. As I mentioned, the first two bullet points are things which we believe would be certain things that are probably most common if you're already using EthosCE or have been considering the use, because you've probably heard from us in multiple channels. The third agenda item is to talk about learning analytics. There, we'll talk a little bit about how we see learning analytics when we are working with different customers. We have some mini case reviews where we want to keep this engaging, so certainly want to make sure we hear from you as well. So we have a few dashboards and a few reporting samples. Routinely, we'll pause. We'll ask you to comment on the dashboard or on the report, see what kind of insights you're able to see, and kind of bring that learning back to everyone, just so that we all get to learn from you as much as you're seeing on the slide deck. So certainly, I'm here to learn from you all and hopefully bring that learning out to everyone else so that it's a great learning experience for all of us. And then finally, we'll do a quick takeaway slide and certainly plan the next steps based off of it. All right. So let's start out with the polling question. Certainly a hot topic amidst all the moving pieces that we are all facing. So the first polling question for the day is, which of the following key challenges do you face managing accreditation requirements? The accreditation standards are complex, changing frequently. I do not have automated reporting. Could be PARS, JA PARS, CP Monitor, CE Broker in my LMS. We have the LMS reporting, but we really need an expert to interpret the complex accreditation rules to my scenario. If there's anything else, you're welcome to add those. So we'll take a couple of minutes. You're more than welcome to select multiple options, because I'm sure some of you may have more complex requirements than the others. Just wanted to get a temperature from the group in terms of what challenges are we all facing. So we'll give a couple of minutes just to get some answers in. You can just type in your answers just with the numbers, either 1, 2, 3. If it's 4, you can just type in what you're seeing, or any other challenges that you think are, fresh off the press, so to speak. And most likely than not, we probably would have more than one challenge from our providers. And generally speaking, from our experiences, we've seen the second one is a challenge, certainly depending on which system our providers are using. Lack of automated system, either reporting to PARS or GA PARS or CP monitor. And then the third one is always a perennial challenge, which is there's always the ACCME's rule or the GA PARS rule that comes in, but then there's also an interpretation out there that might come out from it. So most of the times we've seen 2 and 3, and at least there's one of them are things that a system can address, at least the second one. Yep, unsurprisingly, 2 and 3 seem to be tied, and as we all expected, 2 is an automated reporting to these systems, and then the third is having an expert to interpret the requirements. So very consistent with what we are hearing from our customers as well. Just give another 30 seconds and we'll move on. And a common thing that we hear from people is having access to even a consultant, like a CME consultant, sometimes has been helpful. As you know, Ethos is a technology provider, and we do have external consultants that sometimes we are able to recommend if you feel there are accreditation challenges you'd like to go through. This is completely not an Cadmium or an Ethos service, but organically, as we work with more and more customers, we have had some consultants who've offered to give their services if there is a need. So number 3 is something that we have external consultants who might be able to help, or we might be able to redirect you to the community who might be able to help out with some interpretations. All right. Okay. So to summarize some of the things in our meeting today, we'll focus a little bit more about number 2, which is the automated reporting features. As I mentioned, in terms of having an accreditation expert on the team, Ethos doesn't offer that as a service per se, but we could certainly point you to consultants and even maybe some of our customers if they're willing to share their scenarios specific to your case. All right. So a little bit of an overview here. I won't spend too much of time because I know all of you are probably much more familiar with some of these constraints, but the big ones that we see over and over are the complex documentation requirements. There's so much to manage when you're planning an activity. And then the reporting aspect, once you get the learners enrolling into activities, how do you track their engagement and completion? And then, of course, ACCME or GA PARS or CP monitor. These standards frequently change. And then, of course, the last but definitely not the least, the time and resource constraints. I'm yet to hear a customer who say they have a lot of staff members and they have a lot of time at their disposal. Still haven't heard. So if you're one of those, love to hear from you. But most often than not, absolutely, time and resource constraints are things that you hear routinely. So I'm not going to spend a lot of time on that. Certainly, these things are things that you probably heard more and more. Okay, so the high-level areas in which Ethos could help out is just having those broad areas of credit types that we support. So as you all know, the system comes with a pre-built repository of certain number of credit types, and then we are able to add more and more in terms of additional credit types. So hopefully, once we have a standardized course outline, if you are getting more and more requirements from an accreditation point of view, the course engine is flexible enough to accommodate your needs. But certainly, if you have any specific needs from a newly established accredited provider, or certain nuances are a little more complex, please reach out to us. We'll be happy to help out on a case-by-case basis. We do take pride in terms of our number of accreditations and the breadth of healthcare accreditations that we do support. The second aspect is data-driven insights. So we would talk a little bit about this in a little more detail in the second half of the webinar. And the third is the way Ethos tries to help with multiple accreditations is just giving you that flexibility of having multiple learning formats. To give you an example, we've seen a scenario where some of our customers wanted to have conditional access to certain learning objects based on completion of certain criteria. The most common one is MOC, where for a maintenance of credit type of activity, if you complete a certain quiz, then you're eligible to get the MOC credit. So that conditional access for credit objects is something that we've heard come up quite a bit. And I did want to mention that as an interesting observation, because that does get to the flexible learning options that Ethos supports. So you can have a combination of live and enduring. You can certainly put in attendance as a requirement for hybrid courses. And of course, if you had certain objects to be completed for certain types of credits, you can always have that conditional rule where you could say this particular credit type is available when certain objects are completed. So just to think about certain ideas, hopefully some of these would help you to expand your accreditations beyond the ones that you're currently offering. And then we did see a comment come in, which is about reporting to JA Parse, and appreciate the feedback about the numbers being sometimes not accurate. We'd love to hear about that. If you are an Ethos customer, which I think you are, please open up a ticket or point us to a ticket that's already there. We'd love to investigate that and certainly see what's going on in terms of the reporting. Oftentimes or not, we've also seen the accreditation agencies also change the API. So we try to keep up to date with those API connections, but certainly we'll be happy to review that particular scenario and address it. So thank you for bringing that up. Okay. Awesome. So the next one here is some of the specific integrations with different accreditation agencies. So here you're seeing the most common reporting items that Ethos supports. So the big ones here that you're going to see are ACCME Parse and JA Parse. Ethos does have an automated integration. For some of you who may not be using Ethos yet, we want to talk a little bit about some of these things. When you're creating an activity, a standalone activity, or an RSS series, Ethos has an integration with ACCME Parse and JA Parse, where once you add that information and save the activity, we have an API connection with your ACCME or JA Parse account. And once your learners enroll into these activities, the counts in ACCME or JA Parse are updated. So if it's ACCME, it'll be physician, non-physician counts. If it's JA Parse, you have the 8 categories in terms of physicians, nurses, pharmacists, and other healthcare learners. Those counts are updated via the API. We are also a technical partner to ACCME, and what this means is we pay a yearly fee to ACCME. So as and when ACCME updates the APIs and hopefully keeps us updated, we strive to keep the connection up to date. And as we all know, changes come quite often with ACCME. So we try our best to keep them updated. And we've definitely seen a lot more improved communication from these accreditation agencies. And we also have monthly meetings with these groups to make sure we are upping our game. So whether you're looking at a JA Parse issue in your current LMS, certainly love to learn more about it. If it's an Ethos system, we'd be happy to look into that as well. So whatever is your scenario, hopefully we should be able to handle it one way or the other. The second one is the reporting to MOC credits. So whether you're thinking about ABS, ABP, or any of the 8 boards that are currently partnering with ACCME, we have the MOC credit reporter. And the nice thing about that bridge is, as you're thinking about more and more boards that are joining the ACCME bridge, the connection will be automatically updated. So back when we started off, I think we just had 3 boards, ABIM, ABP, and then slowly but steadily, we've seen more and more boards partnering with ACCME. So hopefully once we get more boards, the bridge would automatically update to accommodate the new MOC boards. The biggest value we've seen here is with ABS credits, American Board of Surgery, because as you all know, or at least some of you who are working with ABS would know, there was a mandate in 2023 where the provider is responsible for sending the ABS credits. And from an Ethos perspective, we saw that was a huge opportunity to streamline your accreditation compliance. So the MOC reporting would help you to automate that process. And we also have failure handling. So if certain credits were not reported, once those are resolved, we can requeue those credits to be sent as well. So the first 2 are more towards the continuing medical education and joint accreditation frame of things. The third is CPE Monitor. So if some of you are thinking about reporting the pharmacy credits, the CPE Monitor helps out with that reporting. Very similar to MOC board, we have a dashboard where you can see every CP monitor credit that was reported. We report ACP pharmacy and ACP pharmacy technician credit. As these credits are reported, you'll see a dashboard. The learner has a dashboard where the status is reflected. The admin has a dashboard where they can see that as well. Happy to go through any of these in a little more detail on a case-by-case basis, but just wanted to give a high level for everyone. The last one is CE broker. Currently, we report to the state of Florida, where the user's profession and other credential information will be taken, and we can report to CE broker in the state of Florida. So the hope here is, as we are working with multiple agencies, we try to streamline the credit reporting framework so that as and when newer accreditation agencies have these automated reports, we're able to scale our reporting framework to accommodate some of those reportings. So if you have a new accreditation requirement or a different kind of reporting that you're thinking about automating, please type that in the chat. We'll take a look at it, and certainly love to hear from you in terms of any newer requirements that you're seeing. All right. With that understanding, we'll focus the next 30 minutes of our conversation on learning analytics. And as you all know, this is quite a vast subject in terms of what areas to focus on. So we certainly didn't want to boil the ocean as much as in 30 minutes. It's just not practical. And it's a Tuesday afternoon, so we do want to be respectful of your other engagements as well. So what we are going to look at here is just an initial treatment of how we have seen other organizations tackle the learning analytics from different dimensions. So you're going to see some dimensions proposed about how to analyze your learning data. But keep in mind, this is not meant to be prescriptive. This is just one approach that we thought might be more logical and something that we've seen from multiple customers as being super helpful when they're thinking about their learning data. So certainly, love to hear your feedback as well as you're seeing some of these dashboards. And also, by the way, we will have some case vignettes for your discussion too. Okay, so when we are thinking about learning analytics, the most common framework that we thought would be useful is to think about analytics in 4 different buckets. And those 4 buckets are listed here, where we are going to look at some analytics related to reaching your audience. The second one is related to engaging your audience. The revenue is listed as the third because we believe that the first 2 will need to be in place for us to get to the third metric. You have to reach the right audience, the right number of audience, engage them to keep that revenue flow coming in from your activities. So that's the R portion, which is the third bucket. And then the fourth one is improving or discovering what's in your learning programs, uncovering gaps in your learning as you measure from some of these analytics. And how would you identify those learner gaps and then hopefully try to come up with newer activities that will hopefully close the gap. So the fourth bucket could be improve or discover, depending on how you look at it. And by all means, there's probably more buckets you can look at. As we said earlier, we just wanted to introduce you to a certain framework that might help you to think about analyzing your learning data. And regardless of which LMS you're using, the hope is some of these metrics will help you to get to a common ground in understanding where your learning program is. So reach, engagement, revenue, improve/discover. All right. The first portion we're going to talk about is how would you measure, or what tools could be useful when you're thinking about, is your content reaching your learners? How are learners trying to find your content? So the most common one that we've seen from our customers and others is the Google Analytics and the Google Tag Manager. So these are the 2 common tools that we hear more often from our customers. Oftentimes, we've heard Google Tag Manager as well, that is really picking up in terms of its traction. And certainly, this is not a marketing class, so I'll try to keep it to a very high level. Essentially, these tools will help you to identify what channels are most efficient when you are having your content out there. So a very common example is, say you have your upcoming pediatrics conference and you're trying to market it in different channels. The most obvious or common use case that we hear from people would be they would market that particular conference on different social media channels like Facebook, X, or LinkedIn, different kinds of channels. Then they would typically add something like a campaign ID at the end of the EthosCE course. And then they would then look at analytics that will help them to find out which channel was the most beneficial in terms of attracting their audience. So that's one. Google Tag Manager is also similar in terms of just tracking some analytics right there. We'll talk about some of the common use cases too in the next few sections. So some of the important questions that you get with these analytics would be, how are users finding your content? What marketing channels are most effective? And how many times has an event or an action has taken place? So in this example, the Google Tag Manager, it has been quite a useful tool where if there's a certain click that you're trying to measure, say how many times have people clicked on a certain button, you can certainly use Google Tag Manager as an option. So there are different use cases. The most common ones we've seen are, is Facebook getting in more users than LinkedIn? Or what kinds of activities are being more popular on LinkedIn versus Facebook? Is there a seasonality with respect to how these courses are being consumed by your audience? So these are some of the questions that we've seen are very, very popular when you're thinking about these tools. Certainly, we could do a little more in-depth analysis about Google Tag Manager or Google Analytics. But like I said, this webinar is looking at introducing you to more like the baseline analytics. Certainly, if you do believe that it makes sense to have a deep dive into any of these, we'll be happy to do a follow-up on these as well. So with that understanding, we'd love to hear from you in terms of how some of these analytics have helped you all. So if you have been using Google Analytics or Google Tag Manager in your learning management system, or thought of using, what LMS insights have you found most valuable? If you've been using it, Google Analytics or Google Tag Manager. If you have been using another tool, we've seen some customers have used other kinds of SEO tracking tools, but certainly these two have been more popular than the others. So certainly, if you're using another tool, we'd still love to hear from you. So again, we'll give about 2 to 3 minutes just to make sure folks have time to review, and then we'll talk a little bit about it. And some of the things, as we are looking at some feedback items from the team, the most common use case for using the Google Analytics or the Google Tag Manager has been using the activity URL as your key marketing tool. So as you all know, if you're using Ethos, every Ethos activity will have a unique URL. In terms of increasing the findability of that course from an SEO perspective, we've also seen some customers use what we call as an alias URL. So as you all know, an Ethos activity would have the site URL / the title of the activity. If your title is already SEO optimized, then you're welcome to continue doing that. But some customers have intentionally tried to use like an alias URL from an SEO purpose. And that has also been very helpful. So say if you had opioid as the keyword, we've seen customers rename that activity to be opioid 23 / opioid 24 / opioid 25. And then those specific ones have been really helpful from that perspective. So there's a question from one of our audience. Yeah, so are you going to go over how to use Google Tag Manager or Google Analytics in Ethos? Happy to go through, at least at a high level, how we've seen people use it. The reports for Google Analytics or Google Tag Manager would be available in your Google Analytics tool. In terms of implementing a Google Analytics or Google Tag Manager, happy to go through the steps. So I'll quickly answer that question. When we're thinking about implementing Google Analytics, we have an intake form where we ask our customers to provide a Google Analytics ID. And once you give us the ID, we have a configuration step where we can add the Google Analytics code on the Ethos website. So with Google Tag Manager, there are a sequence of steps that we would go through where there's a container ID that the customer would provide to us. And then we'll have documentation about how you can add Google Tag Manager on the Ethos site. So once we add either the GA code or the Google Tag Manager on the Ethos site, you are welcome to then go to your Google Analytics screen, and then that should populate these reports based on whatever code that was added on the Ethos site. And those particular things would be helpful when you're trying to analyze some of these matrices. So to give you an example, we've had customers who added a Google Analytics code specific for their LMS initiative. And once they analyze the Google Analytics reports, they were easily able to find out that for certain courses, Facebook was more popular mechanism for attracting learners compared to LinkedIn. And they were also able to try that out for different courses. And what was interesting is based on their activity type and the target audience that they were targeting, the social media channels varied. Certain courses were hugely popular in Facebook because that was organically the demographic that was using it, whereas certain kinds of activities, the Google Tag Manager was more popular. So that's an insight that we've seen being pretty popular when you're trying to use Google Analytics or Google Tag Manager. So if you're not using those, we encourage you to think about it. Certainly, your marketing team in your organization will be able to give you access to Google Analytics or Google Tag Manager. If not, we encourage you to speak with your marketing team, see if you can get a Google Analytics account, and then just play around, add it to an Ethos site, see what kind of analytics you're able to get, and then love to hear from you once you start adding it. And you could easily add Google Analytics just as a part of the standard framework. In fact, we would have like an intake form where we would ask you for the Google Analytics code if it's available. So definitely encourage you to try that out. I'm certainly happy to hear from you once you've tried that. All right. So that was the first portion, which is some of the metrics about reaching your audience. There's probably a few more tools, but given Google Analytics and Google Tag Manager has been very popular, we try to focus on that. Next, we'll move on to some engagement level metrics. So before we get going on that, we want you to hopefully answer a hopefully simple question. Think about your favorite TV show or a movie, and hopefully think about why you liked it and what kept you engaged throughout. And just in case you were interested, the image on the right side, I've generated it using ChatGPT, and I was just playing with some basic prompting. And I like the image, although I'm unsure which movie or if it represents a movie, but I felt it was good enough for a slide deck. So inspired by ChatGPT. All right, so we'll give you a few minutes to think about it and what were the portions that you liked about the movie, or what was the hook, so to speak, that kept you engaged. Just to get some juices flowing, I want to turn it on to Amanda. Amanda, what kind of TV show or movie was like stuck with you that you really, really liked? I'm not able to hear you, Amanda. Sorry if it was only in my end.
Can you hear me now?
Yeah, I can. Okay. I was super excited to hear it. So yes, I can't wait. No worries.
I was mostly giggling to myself. So my favorite show that comes to mind is actually Schitt's Creek, which is a Netflix, or I think a Netflix show. Yeah.
Wonderful. And why would you think, why do you like it? And are there pieces that kind of kept you engaged throughout the conversation?
Sure. Yeah. So it's not a fantasy show, so it doesn't take you out of reality, but it does make fun of things in a way that you're able to like reframe your brain and just sort of like shut out the realness of life while also making fun of some of the things that everyone kind of goes through. The humor is just over the top. The cast was really great. And one of the things that I really liked about this show is that they had like recurring themes of like jokes and comments that would be made throughout the episodes and also throughout the series. So when I would hear one, let's say episode or season 3, I'm like, oh man, I forgot where that came from originally, and then go back and start over again. So definitely a hook.
Oh yeah, absolutely. That's I think the familiarity and the theme, and once you're hooked to a certain theme, the next version of it kind of reminds you of the same theme, and then it adds the engagement factor. Is that what I'm getting?
Yeah, absolutely. I think that's a fair assessment.
Oh, wonderful. Yeah. I always say the Criminal Minds is one of my favorites. And the interesting thing is, even though both of these are vastly different, I'm into murder mysteries and things like that. The thing that really hooked me throughout is once you get hooked to the characters, and if any of you were watching Criminal Minds, my favorite character is Reed, who is this geek scientist who really has a very different perspective about how he analyzes a crime scene. And once you really attach yourself to that character and you have that hook, you keep coming back to it. And whether he solves, mystery 1 or mystery 50 or mystery 500, you kind of get back, and the hook is what keeps you coming back to it. So interesting, Amanda, even though both of us have vastly different genres, the hook is the familiarity with the theme and how you enjoy that familiarity is what I'm getting at it.
Yep, sounds right.
Awesome.
And we heard we heard from Brenda that Outlander, action and emotion keeps you engaged. I've heard that.
Oh, I love that. Yeah, Brenda, thanks for sharing that. I totally agree. I love that Outlander movie in terms of just the reoccurring theme of the emotion. It's quite common to have both of these, but I feel very few do a good job of blending both of them together without sounding either too emotional or too cheesy. And I think Outlander does that well. Great one. Any other interesting ideas that the team had? Maybe we'll give another 20, 30 seconds, and then we'll jump on. Great themes. I'm so glad to hear a couple of these themes resonate from people.
So one person actually added Killing Eve, which is also a good show, I think.
Oh, I love that. That is wonderful.
That you never knew what was going to happen. Like that's what the comment is. Like you just did not know. And as soon as you thought, all right, I'm over it. I'm tired of guessing. They literally pull you in at the end for the next episode. So yeah.
Yes. I love that when any of these episodes, especially if it's a continuity to the next one, everything is fine until the 55th minute. And the 57th minute is when you're like, I have to see the second one. And I think one of my favorite binge watching streaks was, believe me or not, 7 episodes. I think me and my wife watched it for like 6 hours, I think. And at some point, Netflix was like, are you there? And we were like, we are absolutely engaged, just a lot more caffeine out there, and very much engaged with the show. Yeah. Excellent. Well, thank you so much. So thanks again for sharing. Yeah, thanks, Amanda. Appreciate your feedback. All right. So bringing this back to our learning journey, the approach that we will take when we're trying to analyze engagement from a learning perspective is obviously the familiar one, peel the onion. So we'll try to look at engagement analytics from different dimensions when we're looking at a learning system. So our initial analysis of it is we'll start at program level. At a very high level, what kinds of metrics are you looking at when people are engaging with your program? Then we look at the activity level, peeling the onion. How did people engage with your activity? What kind of metrics might be interesting when you're thinking about engagement at the activity? And then hopefully you discover the hook, which is the learning object level. And whether it's a humor, whether it's action, emotion, suspense, thrill, whatever that is, hopefully as you're peeling it out, maybe at the third layer here, you're able to find out what exactly are portions in my content that kept people engaged. So depending on what story your data says, this peeling the onion will help you to hopefully get to why is my content resonating with people? And is this a theme that I can keep repeating once I'm able to find out that this is the reason for hopefully multiple people coming in? And hopefully we have some examples that might help you to get some creative juices flowing. So 3 levels. Program, activity, learning object. And if any of you are interested, again, the image on the right is courtesy of ChatGPT. The prompt I gave it was, I'm thinking about peeling the onion. The topic is engagement analytics. Please come up with the image. And not too bad. I was expecting many more typographies, but I think I was lucky that it just came up with one typography here where it misspelled analytics a little bit, and then it blurred insight. So not too bad. I was expecting many spelling errors there, but I think it did a pretty decent job with its image. Okay, so let's start with the caselet here. These are all mini cases. So the hope here is, as I said, we'd love to learn from you as much as we would like to share what we learned as we are working in this industry. So for each of these scenarios, we will come up with explanation of a scenario, and then we'll come up with a metric, a report, or a dashboard, and we're curious to see how exactly you're interpreting the data. And keep in mind, there's no right or wrong answer. It's your story and what you are more interested in. So we'll keep that. Okay, so this is the caselet here. There is a XYZ Healthcare pull their user engagement dashboard from the last 12 months. User engagement dashboard in this scenario is a global dashboard that will talk about how users are engaging with the learning platform. And there are several analytics that are displayed here. And we'll spend a few minutes here because it's a busy slide. The question here is, what key metrics would you be most interested in tracking? Keep in mind, there could be multiple correct answers. We are interested in learning what are some of the things that are most important for your organization, knowing your learners. So there are multiple areas. I'll just read out some of these there. You have some metrics related to user accounts created versus accessing the site versus enrolling in multiple courses, average enrollments, completions, enrollments by completions, and then users created versus enrollments. These are some of the areas that you're seeing here. Or if you wanted to have another metric on this dashboard that you were really interested in, we'd love to hear that as well. So a minute probably, just to get everyone's time to review and digest the content. Yep, thanks, Brittany. We see how many users register and don't receive a certificate. We have a lot of people having a hard time navigating through objects. Yep, great observation. Christine says registered versus completions. Excellent point. Enrollments versus completions by month. Great. Great point, Amanda. And as you're seeing some of these, what are specific things that stood out for you in terms of this particular data? Now, agreed, this is training data, so we have fewer learners, but at least based on what you're seeing here, are there aspects that were a little intriguing for you? So I could definitely say, in terms of enrollments versus completions, it sounds like the August, September, October month seems to be super, super quiet. And Kathleen is asking us, do you have a metric for actual attendance? Yeah, there are. If this particular dashboard specifically has the enrollment metric, there are other dashboards where you could build your dashboards where you can plug in the number of attendance or the number of people who are marked attended using building some of your own dashboards. But yes, there is a way to track that. All right. Okay. So the next one here would be the key ones that I think we have seen people really like is average enrollments per learner and then average completions per user. So here, the big one here is there are 1.9 average enrollments per learner and 2.5 completions per user. So most of the times, what we've seen people do is they would track these two metrics year on year, and then they would see even quarter on quarter, and then they would see if this metric is something that they would keep increasing one quarter to the other. So we look at another dashboard. This one is the snapshot for enrollment by month comparison. So the green bar here talks about the 2023 year, and then the blue bar talks about the 2024 year. So here you see there was a dip in enrollments compared to green to blue. And then specifically here, they see the pattern is relatively consistent in terms of each of these months. So January, it started off when their enrollment opened up. And then again, from February, March, April, it really started dipping down as well. So this is another metric, a metric that a lot of our customers appreciated, specifically because this gives you information at the activity level. So you can pull in, if you go to EthosCE Analytics page and you look at enrollments by month comparison dashboard, you can pull in two activities, activity from this year and activity to the last year. And then you'd be able to compare how did learners do in 2023 versus 2024. And then even look at specific metrics about why certain learners were dipping out in certain months. The organic step that we've heard would be useful from this point onwards is once you have learners who have been relatively quiet in this particular quarter, they were able to actually leverage some marketing tools and then send in more and more reminder emails, marketing emails to kind of see if that helps with the number, so to speak. All right, so I'm quickly going to read a couple of questions. Question from Andrea, what is the difference between users logging in and users accessing the site? So I think in terms of, depending on the specific dashboard there, Andrea, the login would be when they're logging into the system. Accessing the site would mean if they're starting on a certain object. So depending on the dashboard you're looking at, those metrics might be different. But sometimes we also have a different metric where it would be the users starting a course. So depending on that dashboard, you could have the same numbers or different numbers. And question from Brenda, how about completions versus enrollments by profession? Yep. So this particular one is giving you enrollments by month. When you're thinking about building your own dashboards, Brenda, there is an area where you can look at all the completions and enrollments. You can add a filter called the user profile filter, and that will give you a breakdown by different professions. So as long as your profession is available as a user profile field, you'll be able to do that. So depending on the different kinds of metrics, you might need self-service analytics for it, but there's a way to get that kind of data. Andrea and Brenda, let me know if that answered the question or if you had any follow-up questions. And then we are also seeing a few other metrics that came up from the previous dashboard: completions by credit type, enrollments by credit type, or by profession. So all of those metrics are key ones that you would typically look at when you're building your course dashboards. The next one, peeling the onion further to the third level, this particular metric is assuming that the customer is using WarpWire, which is our video analytics system. And arguably, so this is a metric that we've seen not a lot of customers tend to leverage this, but we did want to highlight this. If you're using WarpWire and you log into the WarpWire account and you go to a particular video, you'd be able to look at video analytics. And we've taken a couple of screenshots that talk about the video analytics portion of it. So here there are two analytics. One is at a global level where you can see how users are engaged. This gives you at a high level, 8 people have viewed the video, about 300 minutes have been viewed, and at an average, you have 44% engagement in that. And then this gives you a little more analysis about the individual learners and what portions of the video they've watched. So tying this back to our engagement example at the beginning, when you're trying to look at program level analytics, looking at activity level analytics, if video has been your primary mode in terms of your content, we've seen a lot of customers appreciated this report because this gives you critical insights about where people are watching and where people are dropping off. So to give you an example, in this particular video snippet, it sounds like there are 3 learners who almost skipped a good portion of a half of the video. So you see Zoe and then the support customer and then Crystal, they've completely skipped the second half of the video. 3 learners, which is almost half of my learner base. And then you've seen a couple of learners are completely skipping out the middle portion of the video. So to give you an example, when we had a customer who analyzed this kind of data, they actually saw a pattern in their learning journey where they saw a lot of customers were skipping out the last 15 minutes of the video, right in that portion. So that data point was a clear metric for them. And when they looked at their activity or their webinar, they found out that the last 15 minutes was more towards Q&A. And a lot of people thought Q&A would be better served as a separate learning object. So what they did is they had this 1-hour video. They looked at the video engagement analytics. they found out that the last 15 minutes was being skipped frequently. They split the video into 2 portions where they said 45 minutes is your content, last 15 minutes is your video. So depending on, again, what kinds of insight you're hearing, you'll be able to actually get to that root cause of what is resonating with my learners and what's not. And this is a good example of how you might be able to use it. So this is a WarpWire video. It's called the Video Analytics Dashboard. That's already available. We'll move on to the next one. Some of you might be using this already, so curious to see how this is helpful. So this is the Learning Object Analysis or Analytics Report, the pre versus post-test comparison. The pre-test is named as quiz. So this portion is the pre-test, the portion on the right. The portion on the left is the post-test. So this is the pre-test. This is the post-test. So if we could take a couple of minutes and see, are there any specific insights that stand out to you when you're looking at the pre versus post-test data for these 3 questions? So to interpret the data for you, this is the pre-test, and wherever you see the score as 0, that's the incorrect answer. So in this scenario, it means 29% of my learners have answered question number 1, have selected choice A, which was incorrect. In this case, 71% of my learners have selected false as the answer, and that is correct. So just 30 seconds or so, and then we'll move on. Okay, so most of you might have figured this out. The big analysis that you see here is when you look at question number 2, 12% of my learners have answered that correctly, and that number marginally increased to 38% in the post-test. So the one big metric that is standing out here is 12% to 38%. So that could also mean a few other things. There are some psychometric indicators towards the right where you could see specifically correct factor, standard deviation, discrimination index, discrimination efficiency. And then based on some of these data points, you may be able to find out, was this question poorly worded? Was this question, does it need to be rewritten? Or was this truly a good question that differentiated the high performers versus the low performers? So I'll quickly answer one question before I move on to the next one. There's a question about, are there analytics where it reports trends of video watching? That's the parts they were watching and not watching versus the individual statistics shown here. So currently, the data is more granular at a learner level. We can certainly take that to the video team and present a response back, whether there's an aggregate data. Currently, it's more granularized at a learner level. All right, so we'll move on to the next one. In the interest of time, we'll skip this and move on to the next one. So a few reports when we're thinking about the third component of learning analytics is the revenue generation. And I think the vastness of this topic itself, we could probably do like a part 2 of video of learning analytics focused on revenue generation. To give everyone like an introductory treatment of some of the common themes that we've seen resonate very well is to build revenue analysis based on different criteria. The most popular ones, if you're on the Ethos Analytics page, you are going to see revenue by revenue report, where you can easily look at revenue per product. Taking that one step further, our customers have actually sliced that data by target audience, either by looking at some of the existing data. Oftentimes they're not, they would build like a self-service analytics dashboard where you're able to pull in this revenue data and then add your demographics filters in terms of target audience or date or time or other demographics. You can certainly add all of those things as well and see if that's helping you with some more insights. So the most common ones that we've seen here are the target audience, where you could say, do we have a revenue generation opportunity with a certain demographic segment? And oftentimes they're not. If you're strategic about what kinds of tags you're adding to your course and your learners, that would be really helpful when you're generating these reports. Because as a reminder, you could add additional custom profile fields on your user profile, additional fields on your course, And you can leverage those effectively when you're trying to look at analyzing trends and opportunities. So the big one is definitely the target audience, and then the seasonality. Do you have certain seasons or quarters where your learners are more active when they're taking courses? And the correction item that we've seen is you might want to use like coupon codes if you're trying to drive more people in areas or seasons when it's relatively low. Or you may want to do more marketing using one of these channels that we discussed earlier to bring in more people for your activities. Now, there could be other demographics as well that we've seen. It could be hospital center. If you're working with multiple hospitals, you can add that as a demographic field and then see how the revenue is generated per region. We've also seen the country being used as an additional demographic. That would be helpful. And then area of practice, especially if you're into either JA PARS or ACCME PARS, you would have area of practice as a filter. So looking at those demographics would also help you to look at the revenue metrics. In addition to that, going back to our enrollment report where you're looking at enrollments by month, we've also seen scenarios where you would be able to use revenue dashboard broken down by month. So you could certainly take certain months and then see how it breaks down. The last portion of the analytics grouping is the discover phase, where you're actually looking at data to find out knowledge gaps in your learners. As you know, your EthosCE quiz can have question categories, and this question categories can be created based on your organizational competencies. So these could be your learning objectives, these could be competencies that you're trying to measure, or these could be organizational drivers that you're trying to improve using a learning management system. So in this scenario, we've added just 3 quiz categories: opioid diagnosis, opioid prescription, and patient communication. And what Ethos does is it helps you to aggregate this data across multiple quizzes. So say if you had 100 activities, 100 quizzes, this report, it's available again on the EthosCE analytics page, where you can look at quiz question performance by category. And then each of these categories will be giving you information about how your learners are consuming content. And a common one that you're going to see here is if you look at patient communication, 30% of the responses were correct. 70% of the responses were incorrect about patient communication. Now, keep in mind, this is not one activity. This is across all the activities. Wherever there was a quiz question that was tagged with patient communication, 30% of the responses is correct, 70% was incorrect. So this could be your aha moment where you could specifically look at this data point for your needs assessment. If you're an ACCME provider or a JA provider, it could also help you to plan your next round of CE activities based on maybe more emphasis on patient communication. And it also might help you to address one of the commendation criteria where you're actually using these gaps and then trying to plan your CMEs based off of that. Now, this is a block report or a standard report that's available. The extensions that we've seen beyond this is how do you break this down by area of profession or let's say any of the demographics. So again, going back to build your own dashboard scenario, you'll be able to take some of these reports and then add those filters with user demographics and then potentially explore this by demographic. Is this patient communication specific to certain learners with a certain area of practice, belonging to a certain university or belonging to a certain hospital or a health system? So you can really drill down further based on whatever data point is most important to you. A few others that we commonly see are the quiz category report that we've already seen, evaluation feedback. There are reports where you can aggregate the evaluation data. We've also seen customers try to create newer dashboards based on aggregating evaluation data, either selecting just one question, which might be a bias question. You can just aggregate that question across multiple activities. And then also think about using commitment to change as an instrument. So commitment to change is available in standard Ethos, where you can specifically ask that question after the evaluation. Once your learner answers that question, you'd have a commitment to change report where you can see specifically what were the changes in practice or what were the barriers that were anticipated. So again, you can use that data and your quiz category data for your needs assessment down the lane. So we'll do a quick synopsis. We've reviewed the learning analytics in 4 key dimensions: the reach level analytics about Google Tag Manager, Google Analytics, the engagement level analytics, where we spoke about peel the onion with respect to program level analytics, activity level, video hotspot analysis, revenue, where that itself could be a vast subject, but we've looked at revenue analysis based on key criteria, could be target audience, area of profession, and seasonality. And then the last one, improve or discover learner gaps using quiz data, evaluation data, or commitment to change. So with that understanding, definitely we wanted to have a little time for Q&A. Love to hear more about any other questions that you had in mind or any other reports that you wanted to quickly cover. So a question from Rachel, how does EthosCE decide which learners to report to ACCME? Example, everyone who enrolled or just those who attended? Our understanding, and Rachel, we'll confirm this for you as well, it is the enrollment number that we currently report. But I'll make a note of that question and double confirm it for you. Second question from Tara, are there analytics where it reports the trends of video watching? That's the parts they watched, not watching versus the individual stats shown here. Yeah, Tara, thanks for that question. Right now, the video analytics that we showed are more at the individual level. Great question about aggregating it at the activity level. So certainly we'll bring that up to the product team and come back to you with the feedback. Great idea. Yeah, happy to hear a slide deck too. That's an easy question.
Brittany just commented the pharmacy one you mentioned.
Absolutely. And I'm sorry, Amanda, was there a question? I missed that.
Oh, Brittany had commented a few minutes ago, let's see, the pharmacy one that you mentioned. So I guess on that last slide.
Gotcha. Let's see.
Oh,
the reporting to the pharmacy report. Sorry, I missed that question.
I believe so, yeah.
Brittany, do you mind?
She wasn't necessarily asking a question. I think she was just commenting on what you were sharing. And I will say we've actually got a lot of questions coming through, and unfortunately we've run out of time, but we will follow up with you as much as we can and let you know specifics to specific questions that you asked. Raja, I want to thank you so much for joining us today, for sharing your expertise and for giving us this time. And I also want to thank everyone in the audience. This was a really great conversation going on kind of back and forth in the questions, and I have the benefit of seeing the full chat. So it's been a really good conversation. So thank you all so much for not only joining us, but for being so engaging and so present and asking lots of questions. And I'm seeing one come through. Brittany, can you show the CPE monitor dashboard you mentioned in the beginning?
Oh, sure.
So that must be what you meant by the pharmacy one. Okay.
Oh, gotcha.
So while you're pulling that back up, Raja, I'll just state real quick a few housekeeping notes, and then you can answer that last question. So again, we will be sending this recording out in the next few days via email, so you have access to the recording. Again, please fill out the survey if you don't mind. It's on Cadmium University on the same page that you used to log in. And we look forward to seeing you at the next webinar. We have lots coming up. Just stay tuned to Cadmium University and you will see the ones that are coming up soon. So Raja, I'll hand it back over to you to answer that one question.
Oh, wonderful. Yeah, thanks, Brittany, for that. So I don't have that screenshot available to write at this moment, but I do have your contact information. So I'll take a quick screenshot and send you how we report data to CPE Monitor. Certainly happy to do that.
All right. Well, that brings us right to 4 o'clock. So let's go ahead and call it. But we'll, like I said, we'll follow up with those of you who we didn't get to answer your questions, and certainly keep them coming in to myself. You can send questions to marketing@gocadmium.com, and we'll also be able to message Raja. So thank you again, Raja. Thank you, everyone, for attending, and I hope you have a great afternoon.